No new quarantine classification has been finalized yet for the NCR Plus as President Duterte still reviews COVID-19 data. The country has seen a record-breaking number of active cases for the third day in a row. The tally now stands at above 190,000. Over 47,000 have been caught violating ECQ protocols so far, but police say they were just either given a warning or fined. Local government units are recalibrating its strategy just like in Navotas, where violation penalties include free swab testing. And even Wolverine's healing ability can save himself from COVID-19 as he decides to get vaccinated, encouraging his fans to follow suit. Focused and fearless. Here's a roundup of stories we're watching now. I'm Jess De Los Santos. Both Malacanang and the IATF have yet to come up with a decision on whether the ECQ status in NCR Plus bubble will be lifted or extended. The palace was set to announce a new resolution tonight, but the scheduled press briefing was cancelled. The ECQ in Metro Manila and the provinces of Bulacan, Cavite, Laguna, and Rizal will lapse tomorrow, April 11. In a statement, presidential spokesperson Harry Roque assures the public that they will give a notice when the details have been finalized. Roque, who has been admitted to a hospital due to COVID-19, says President Duterte is still weighing the pros and cons of the new quarantine classification. Roque adds that the chief executive is reviewing data such as the hospital utilization rate in the NCR Plus bubble. In just 2 weeks of ECQ, the National Police has recorded over 47,000 quarantine violators across the NCR Plus bubble. In today's Laging Handa briefing, PNP spokesperson Brigadier General Ildebrandi Usana said the violators were caught at quarantine control areas and police checkpoints. According to Usana, more than 24,000 violated the non-wearing of face shield, while some 2,500 were caught for not wearing face masks. Others were given warnings for not complying with mass gathering and physical distancing policies. Usana noted that the police force has not made any arrests.
Ang instruction po ng ating PNP, wala pong arestong isasagawa ang ating mga kapulisan, no? Either warning or ipagbubutay lang base sa mga ordinances ng mga local government units.
Over in Navotas City, COVID-19 protocol violators are penalized not with fine or community service, but free swab tests. Speaking to us earlier, Navotas City Mayor Toby Chanco said the ordinance will expedite the process of testing and tracing residents who may be infected with COVID-19. Chanco explained that violators will undergo immediate RT-PCR testing if apprehended while testing centers are open. Otherwise, violators have to make themselves available for swab testing the following day.
Kailangan po mapaiksi yung proseso dahil napakalaki ng tsansa na yung mga hindi sumusunod ay COVID positive. Kaya po, once nag-violate po sila, ipapa-RT-PCR test na kagad para malaman kung sila ay positive o hindi at para hindi na sila makapaghawa ng iba pang tao.
We'll be back with more stories after the break. Keep it here on One News. still watching One News Now. I'm Jess De Los Santos. The Health Department reports over 12,600 fresh COVID-19 infections, bringing the total number of active cases to more than 190,000. This is a third straight record-breaking day for the number of active cases. The figure represents more than 22% of the total caseload, which now stands a little over 850,000. The DOH also tallied 225 new fatalities, pushing the death toll to more than 14,000. This comes a day after the country recorded its highest single-day increase in deaths at 401. Some 648,000, meanwhile, have gotten better from the disease, with at least 593 new COVID-19 survivors. Despite the continuous increase in cases, the virus reproduction rate, at least in Metro Manila, has dropped to 1.23 from 1.88. That is according to the latest report of the Octa Research Group. In a One News interview, research fellow Guido David noted that stricter restrictions in NCR Plus has improved the transmission rate of COVID-19. David noted, however, that the reproduction rate is still significantly high as it remains above the threshold of 1. It refers to the number of people that one COVID-19 patient can infect. With this, David said the Octa Research Group is still recommending another week-long ECQ.
Our group recommended 2 weeks. Personally, I believe that if we're seeing a significant improvement by next week, for example, if the reproduction number's already gone down below 1, we're already on the downward trend, then I personally wouldn't mind if we actually loosened our restrictions gradually.
Not even superheroes could escape the wrath of COVID-19. One of them is X-Men character Wolverine, who is played by Australian actor Hugh Jackman in real life. When the 52-year-old actor finally got his jab, he said Wolverine's healing ability can save him from COVID, but the vaccine can. And while he may not have Wolverine's superpowers off cam, Jackman used his influence to encourage his over 30 million followers to get vaccinated as well. Jackman had his last installment in Marvel Comics as Wolverine in 2017 with the film Logan. Over in Texas, United States, COVID-19 cases are declining while infections climb in other areas. That's despite lifting the mandatory wearing of face masks and reopening many businesses. How did they do it? Bloomberg's Fiona Rutherford explains on Quick Take Charge.
So how did Texas manage to reopen and see a decline in COVID cases? What's going on there?
Hi, Tim. Thanks so much for having me on. Well, I'll start off by saying that although things appear to be going in the right direction for Texas, it's still early days, and there are a number of factors that contribute to why we might be seeing cases falling in the state. And of course, vaccinations are one of the key ways to get cases down. And what's interesting about Texas is that they took a completely different approach to many other states in terms of their vaccination rollout. They actually went against the CDC's recommendations by first vaccinating the most vulnerable to COVID-19, which included younger people, so people 16 and over. They also had quite an aggressive vaccine rollout. So Texas was one of the first states, or actually the first state, to administer 1 million doses of the vaccine. So it looks like Texas's vaccination strategy could be working out well for them, especially if they've already vaccinated the most vulnerable people and people who are more likely to be spreaders. And so in addition to that, Texas was hit quite hard with COVID, and so there might be some natural immunity in the population as well. So Texas became the first U.S. state to record more than 1 million cases. And in January, the state recorded more than 2 million cases and more than 32,000 COVID-related deaths. So hospitals were overwhelmed at this point. And then finally, another big factor is that there is still an adherence to anti-pandemic measures and a strong public health messaging around wearing masks. So Texans are still masking up, social distancing, despite the mask mandate being lifted.
Right. So even though that they're not required to do it in businesses, as you point out in your story, Fiona, many businesses are still requiring it, and the messaging has been effective. So Texans, even if they're not required to wear masks, they still are. So that is a contributing factor as well. What I found so fascinating about your story is you spoke to people who live in Texas, business owners there, customers there. How did business owners feel about the lifted mask mandate and reopening? How do Texans feel about their state's progress?
Well, pretty much everyone I spoke to said that all the anti-pandemic measures that were in place before, while the mask mandate was in place, are still in place now, even though it's been lifted. So I spoke to one business owner who said that she has a sign on her door asking people to wear a mask before they enter, and if they don't want to wear a mask, they don't have to come in, but everyone has to wear a mask. And she feels like, people are still quite anxious about COVID, and if people see her staff wearing a mask, then they'll be more comfortable in her store. So that's one of the key reasons she wants to keep her staff and customers masked up. And I also spoke to a restaurant owner who said that they're doing a vaccination drive for their employees and spouses, but even after their employees are vaccinated, they'll still be required to wear a mask. And that, again, was to make sure that their customers feel safe and comfortable in the restaurant.
For more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Jess De Los Santos. We are One News.